When we think of cruise line public health, we have to talk about risk. Um, the more common routes of infection transmission on board a ship. Dan, you created a wonderful model for us, a contagion circle, which really explains how transmission occurs. Can you tell us a little bit more about that contagion circle, that model?
Sure. In my early days, academics, we talked about the chain of infection when it comes to contagious diseases. And that was a good model, but it's probably better for looking at bacterial infections and so on. But we were really looking at norovirus and sort of the ways that it could be spread on a cruise ship. And when you think about it, it's really a group of circles that are all interconnected. And so that's the model that we sort of drew up. And, it starts, I guess, with the cruise ship with passengers and crew that are on board. And when a new cruise starts, new passengers get on board. Possibly some of the passengers that were already on board stay on board. New crew members often come on board. And of course, a lot of the crew members that were already on the ship stay on the ship. And so you have these new passengers, new crew members. And if there was something already going on the ship, some kind of infection like a norovirus, then there's a possibility that these new passengers and crews could be infected, or they could be bringing on infection to the passengers and crew that are already on board. Then, you look at where the ships go. They go to different ports, and at those ports, what do passengers and crew do? They go ashore, and they find different ways to go ashore, but often they're on special outings that have been arranged on the ship. So they have buses or other transportation methods that are taking them to the various venues that they're going to. And those venues are shared by passengers from other ships. The crew members that get off the ship interact with crew members from other ships at the ports. And so all those different connections are there. And then, of course, there are people that come on the ship at the different ports. They may be vendors, they may be entertainers, any number of different people come on the board on board for the day or for a few hours. And again, those are potential sources. And then let's look at the way that diseases, especially viruses, are transmitted. You can have person-to-person spread by people who are actually symptomatic. They're having symptoms. They're throwing up or vomiting, or in COVID case, they're coughing or whatever. But then you also have the exposure person to person with people who are pre-symptomatic or what we call asymptomatic, which means you have the disease, but you're not showing any symptoms, or you're showing very mild symptoms. So you have that going on as well. And those are happening between all these different entities. And then, of course, especially with viruses like norovirus and COVID, you have this opportunity of person to object to person. Well, objects, inanimate objects, we call fomites. So you have someone touching elevator buttons or handrails on a bus or something, and then someone else touching that and then touching their face and becoming inoculated with the organism. And of course, that can definitely happen on the ship or off the ship in various means of transportation. And then, of course, where do passengers always go? They go to places where they can look at souvenirs, and everyone's handling these souvenirs. And there's no way of knowing, of course, how much transmission occurs there. But when you think of all the different passengers and all coming into the same stores and handling the same objects, and probably no hand washing close by.
Right.
You know, this is a very big probability as well. So, and then of course there is, I mean, when it comes to norovirus, it can be spread by water or food. Unlike bacteria, it doesn't grow in food and water.
Right.
So, but it takes very few organisms to make, or viral particles to make you sick. So it doesn't
That's an
have to
important
grow.
point. Yeah.
Yes.